In this video, we will show the results of the endoscopic treatment of bilateral single-system ureteroceles. The ureterocele is a congenital anomaly of the distal ureter. It is frequently associated with duplex kidney. Pediatric bilateral orthotopic single-system ureteroceles are a very uncommon condition. The aim of this video is to show a clinical series of pediatric patients with bilateral ureteroceles successfully treated by an endoscopic route. This is a retrospective review of patients treated between 2011 and 2016. A total of 7 boys were identified. 5 of them presented with antenatal hydronephrosis and 2 of them after an acute pyelonephritis. The 7 patients were studied with ultrasound and MAC3. 12 systems had hydronephrosis and 8 of them presented an obstructive pattern. None of the 4 patients with pre-op MCUG had reflux. Surgery was offered to all patients, in 7 for increased hydronephrosis and in 2 for urinary tract infection. Mean age at surgery was 9 months. All patients had circumcision. Endoscopic treatment was performed with diathermy BAC-B ablation in 5 patients and with laser holmium for the last 2. For the laser ablation, it is important first to set the equipment. A 9.5 French integrate cystoscope with a 5 French working channel was used. We recommend the holmium Yagg laser with a 365 fiber. The equipment was set on 0.8 joules and 7 Hz. With the patient on lithotomy position, a regular cystoscopy was performed. Patient had a normal urethra. At the entrance of the bladder, 2 orthotopic ureteroceles were identified. The ureterocele on the right side was non-obstructive. Therefore, only the left side with an obstructive pattern was treated. The laser fiber was introduced into the bladder. First, we illuminate the target tissue. Care must be taken to perform the incision at the lower end of the ureterocele in order to avoid post-procedure reflux. Sometimes it is better to turn off the light of the laser in order to see better the site of the cut. The ureterocele frequently collapses soon after the first incision, which makes a little bit more difficult to continue with the incision. However, the incision must be wide in order to prevent recurrence of the ureterocele. Another advantage of the laser ablation is the reduction on the collateral damage to the tissues. Once the incision is done, a cystoscopy through the ureterocele is easy to perform, even going high into the ureter and making sure that the incision is wide enough. After the procedure ends, we empty the bladder and we put a Foley catheter for 24 hours. The patient was discharged the following day. Patients were followed clinically and by ultrasound. After a mean of 22 months, all remain asymptomatic with resolution of the hydronephrosis. This preoperative ultrasound shows bilateral ureteroceles on the bladder and left hydronephrosis. The postoperative images shows resolution. In conclusion, bilateral pediatric single-system ureterocele is a very rare condition. This video demonstrates successful endoscopic treatment in a consecutive series of 7 patients. We recommend holmium laser ureterocele cut because it offers an easy-to-perform technique with very good outcomes.